The AG says Sweetwater Care has been failing to meet minimum staffing levels at its nursing homes for years, putting its residents at risk. An advocate we spoke to was happy to see those laws being enforced by the AG because he says the state regulators that actually oversee nursing homes are not doing enough.
Wow. This is awful.
Despite the strong reaction.
Oh, my Lord.
Reading allegations against a chain of nursing homes.
Oh, my gosh.
Treva Lewis says she's not surprised.
I knew my gut was right. There is something wrong.
She says she's felt that way over the last few years of her sister's roughly 10-year stay at Rancho Seco after new owners took over. She's been worried about the quality of care and staffing.
It is a matter of safety at this point.
The nursing home is owned by Sweetwater Care, a fast-growing company in California. In 2020, it had just 2 facilities. By 2024, it had 19. That's all according to a civil lawsuit Sweetwater is facing from the California Attorney General, a lawsuit Lewis is reading for the first time.
Days licensed, days below. Wow.
It alleges while Sweetwater was collecting more than $299 million in public money through programs like Medi-Cal and Medicare, the company prioritized profit over people, consistently failing to meet minimum staffing levels required by law.
Staffing is everything in nursing home care.
Tony Chicatel with California Advocates for Nursing Home Reform explains not having enough staff puts residents at risk.
When there's not enough, then corners start to get cut. Accidents happen, mistakes are made, and people suffer and die as a result.
In May of 2023 at Rancho Seco, the lawsuit alleges someone who reported leg pain and swelling went 4 days untreated. Turned out the resident had 2 broken bones.
That is so sad to hear.
The lawsuit details several allegations like this at several Sweetwater Care facilities going back to 2021. What was your reaction when you saw the allegations?
Well, my initial reaction was disappointment that the Department of Public Health hadn't done anything prior to stop this chronic understaffing.
CDPH licenses and regulates nursing homes. That includes enforcing staffing standards.
They can issue fines, they can issue daily fines, and keep the pressure on the facility until they get their staffing levels up to where they should be.
So what did CDPH do? KCRA 3 Investigates dug up the data, and here are a couple examples. We'll start with Valley Care Center. Since Sweetwater Care became licensed to operate in California, the lawsuit alleges Valley Care Center's staffing data shows non-compliance for at least 1,270 days. In that time, CDPH records show it cited them for non-compliance for just 90 days. Then there's Yucca Valley Nursing. The lawsuit alleges non-compliance for at least 1,252 days, while CDPH only identified and fined them for 72.
We have a Department of Public Health that's supposed to enforce these staffing standards and oftentimes doesn't.
Each time the fines from CDPH were a result of staffing audits of a random 24 days, staffing audits that happen just once a year.
The maximum fine in those cases is $50,000. So once a year, $50,000 fine is not going to be enough to dissuade a facility that is making over $1 million, increasing their profits by $1 million or so by chronically understaffing the facility.
Of course, we thought you might want to hear directly from CDPH, but the state agency refuses to sit down for an interview on camera. Instead, CDPH only responded to questions for the public with prepared statements over email. So when KCRA 3 Investigates ask what's preventing CDPH from doing more to enforce staffing standards, would it require more staff or funding? A spokesperson wrote in part, CDPH remains committed to working within its regulatory authority and utilizing all available resources to ensure compliance and protect residents. It didn't say if it would need more resources to do more, and it couldn't point to any restrictions on its regulatory authority stopping them from, say, doing more than just one audit a year if a facility is repeatedly in violation.
I think the message to the facilities all throughout California is the staffing standards don't really mean much.
But he is encouraged by the Attorney General now taking up the issue, and so is Lewis.
This one hits home very, very hard because I have a family member there.
A family member depending on her and on the nursing home.
And they're depending on these people to help them with dignity and respect.
Last month, we reported Rancho Seco Care Center is fighting $227,000 in state fines. Since then, we've also learned they're facing more than $478,000 in federal fines, which they are also trying to appeal. Back to you.
The Attorney General's office says that they didn't want to speak on camera, and neither did the attorney representing Sweetwater Care and its nursing homes. He said that he'll focus on addressing the allegations in court.